Good morning, everyone. I'm Megan Cullup here with Scott Micklin for today's Community Information Hour.
Here we are. Wow.
Sorry.
That's wishful thinking.
Yeah.
Okay.
Maybe we have a lot more to say today,
We
Scott.
may have a lot more to say.
Yeah.
It's been 3 days since we were with everybody,
After all,
so
it's been 3 days.
there could be a lot of things to say, but good morning.
Good morning.
I'm glad that you were back, and
Yes.
I'm back, and
We're
our
still
viewers
here.
are back.
We're
Yes,
still here. We know it's Monday.
we do, and we have a lot of information to share.
We do.
Which is important, and that's why we do this
That's right.
Monday through Thursday, but we also do it to maybe look at some of the brighter side of things and positive things, and
Brighter
so
side of life.
that's important, right? So here we are. Easter's over, and now spring is springing,
Spring is sprung.
and, you know,
Feeling a little more redeemed.
I'm dressed
this
like a
weekend,
robin's egg
Scott.
this morning, so there you go.
That was good.
You're welcome. Yeah.
I liked that.
Thank you.
You have a way with Photoshop.
Do I?
Yeah.
Oh, okay. All right. If you say so.
I think so.
You don't think those were real?
Were they?
You don't think so?
You weren't in a bay window with a bunch of eggs surrounding
Well,
you
you
this
know,
weekend?
I may or may not have grown rabbit ears one year.
Okay,
I'm
all
just
right.
saying.
Cool.
But thank you for
Cool.
noticing.
Yeah.
Anyway, we're glad everyone's with us. Coming up on today's show, Jeff Bourgeois from the hospital, Salem Regional Medical Center, is going to be talking with us to give us kind of the latest updates on how the hospital is ramping up to deal with these local cases. We'll talk a little bit about the numbers, of course, and talk about some of the things that have been going on in the community.
That's right. So are we going to hit the numbers first?
We can. Let me
think we
get them.
should.
Let me get them ready.
Oh, man.
So
Always, you want some national stuff
what do you got?
while we wait?
I know you had some things to share.
Well, I do. Well,
Okay.
first of all, we've now doubled 0.5. I don't really know how else to say that, but doubled and a half in New York City, the death toll of September 11th. So, yeah.
There's
so that's
that.
a thing. So that's not exactly the most cheery
No.
thing. But on a brighter side, all of the artists of America are coming out of the woodwork, and all of these businesses that have shut their business down temporarily, and including putting up, boarded windows, all of these muralists are coming by and creating these amazing works of art.
No, that's cool.
That is cool.
I like that.
Yeah.
And I've also seen some like chalk drawings on the sidewalks
Yes.
outside of homes and businesses too, from maybe
Yes.
some kids are doing some of that.
Yeah,
and-
there's a couple of kids down the street from my house that are killing it with the sidewalk chalk these days.
Nice.
Yeah,
See, so that's kind of cool.
it is cool.
Uplifting messages.
Yeah, hilarious jokes. Hilarious because they're bad. Like they're bad.
Oh,
not
well.
like crude. Although that would be even better.
Well,
if these like
don't know.
little kids were
No.
leaving. Okay.
I don't think that would be better.
Okay.
Sorry.
All right.
But that's
Cool.
okay.
Cool.
Always positive I'm always in favor of more dad jokes
Yeah.
from me.
I know this about you.
Yeah. Anyway, so the numbers came out
Okay.
over the weekend, of course, and we want to talk a little bit about those. A little bit of sobering statistics, of course. We're now at 1,174 cases in New Mexico. We've got 151 here in San Juan County. This weekend we saw the first fatalities in San Juan County, and so that is, I think, worth note. Both of those folks were hospitalized. Both were, I would say, somewhat elderly. There was a woman in her 70s who passed away, and a man in his 90s, I believe, were the two. Or I could have them reversed. Man in his 70s, a woman in her 90s. But in any event, those are the two fatalities that have been reported to the state. Those deaths, of course, part of the statewide numbers. And then the recoveries is worth noting as well, up by 60
Yeah, there you go.
for 295. So those are the numbers. And again, we are sharing these every day as the state updates them. That's where we put them on our website, ksje.com, under the news category. And you can check that out. And then any other local stories we are also sharing. But this is what the state gives us, all the breakdown, where it's been detected in some of the nursing homes across our state. And the county by county breakdown is right there. But then as we keep scrolling down, you can see the numbers from the Navajo Nation. And, of course, we talked with Chief Francisco last week about their big curfew, which I think went well, but I haven't heard or seen any notices about
they
it.
did make the New York Times this weekend.
They did.
Did you see that?
Yes.
Yes.
Well, I think a lot of national media has been covering what's been going on
the
because
Navajo Nation, yeah.
the numbers have been increasing a little fast
Yes.
for everyone's liking. And again, you can see another 100 cases from the Navajo Nation over the weekend, 2 more deaths, and so there is that. Then in La Plata County, there was no change, and Montezuma County had 1 more fatality and 2 more cases over the weekend. So that's the numbers from there. So that's where things look today, everybody. And so that's why, again, we keep seeing the advice to stay home, don't travel, don't mingle, don't hang out with other people. That's important.
It's hard.
It is hard.
Yeah. The
but
moratorium on mingling, man.
I understand.
Yeah.
The mingle moratorium.
The mingle moratorium.
Apparently is
yeah,
what it is.
We'll ask them about that, the docs about that on Thursday.
All right. We do have
Yes.
two of the doctors, I think at least two,
Yeah.
hopefully, from the hospital, planning to talk with us on Thursday.
Stoked.
So that's good. They took a week off, and I think they're ready for us again after taking a week
Yeah.
off.
Whew, we got to recollect after
They just
that.
needed a little break
They
from
did.
Scott and Megan.
That's right.
And I understand it.
That's right. Yeah. Don't
So-
we all?
Right.
Yeah.
From time to time.
From time to time. The Micklin moratorium.
There you go. Or the Megan moratorium.
That's right.
If you want to
It
go
works-
there.
It works both ways.
Exactly. I'll put up the phone number if folks want to call in and let us know if you have seen something positive in our community. We invite you to share. We know there's a lot of great things going on. We know there's a lot of ways that families and folks are staying safe, but still being able to get out maybe and physically distance, but still get out on the nicer weather.
Yeah. Well, you want to hear about this drive-by birthday party that we did this weekend?
You had a drive-by birthday party, didn't you?
did.
Yeah.
Not for me.
No.
But
You are not yet that old.
I am not 100 yet.
No, but
one
someone else was.
Somebody else was. One of our local peeps, old Presbyterian lady, turned 100 this weekend, and so we all kind of did a drive-by thing. We honked, and she came out on the porch.
Nice.
We stayed in the car and yelled good wishes out the window, and it was really sweet.
That's very cool.
Yeah.
I bet she was touched by that.
She was touched by that. She's hilarious. She's got more energy than some 40-year-olds I know, so
Isn't that amazing?
it is amazing.
Good for her.
I know.
But yeah.
I want to know what she's taking.
Right?
Yeah.
Yeah. No kidding. That's true. We should bottle that.
We should bottle.
Sell it.
Mrs. Stevens, if you're listening.
Yes.
Yeah.
There you go.
Please bottle that.
That's right. But congratulations. Happy birthday.
Right?
To her.
Yeah.
And I've seen that from other, like maybe some teachers from some of the schools have been
Right.
driving through neighborhoods.
Drive-by parades.
And for some of the kids.
That's right. One of the, the Tibbetts Middle School band teacher had her students hop outside this weekend and play their various instruments.
That was on Friday, I believe,
Friday, yeah.
at 10 o'clock. And I think even the college was involved. I think Dr. Fetz was promoting that as well and encouraging anybody that had an instrument. And there was a certain piece of music they were going to play at 10, right? To get
Right.
out and play the same piece.
Right.
And see if you could hear them throughout the community.
Yeah, it's really sweet.
Yeah.
Yeah.
I like
I
that.
heard some drums.
Did you?
Yeah.
Okay.
So that was cool.
That could be cool.
Yeah.
Very nice. So there you go. We do have a phone call.
All right.
So let's go to the phones and see who's calling in. Good morning. Good morning. You're in KSJE.
Good morning, Scott. This is Jeff Bourgeois. How are you today?
Hello, Mr. Bourgeois. I'm well. Thank you. Thanks for calling. And Megan Collup's here as well. Appreciate you being with us. And I guess the big story with the hospital certainly has to be about the announcement of furloughs late last week. Can you talk to us a little bit about that probably very difficult decision?
Well, it certainly was, Scott, and I want to just make sure that it was a decision that we didn't take lightly. But we started with the reduction in pay for all members of our senior leadership team, including myself, and then we went to our employed provider group, both physicians and advanced practice providers, and asked that they consider a voluntary reduction in pay, as we have a contractual relationship with many of them, and many of them stepped up and voluntarily took a pay reduction. And then we also took some steps in that process to make sure that those physicians and providers that are really on the front line in dealing with COVID patients, such as ED and hospitalists, urgent care and primary care, that we took steps to keep their compensation whole, even though they're not really, their volumes, just ironically, are way down from what they typically are. So, and then in looking at the benefits within the CARES Act, that federal stimulus package, and the enhanced unemployment insurance benefits, we decided to move ahead with this temporary furlough. And it's important to note that we have many employees that aren't on the front line of clinical care, whose workload is greatly reduced given the current circumstances. And then we have those who are in other clinical departments whose work is of a more elective nature, and consequently the workload in those departments are greatly reduced. So by combining the state unemployment benefits along with the federal enhancement through the CARES Act, we can keep many of our employees whole from a financial component or perspective, if you will. Not all of them, but the majority of them for certain. And then we are also maintaining our benefits for those employees who are temporary furloughed. And we tried to create it such that we could offer a rotating furlough basis, if you will, to allow people to work essentially a week on, a week off during a given pay period, wherever we can make that possible.
Jeff, I have a question. So it seems rather, I think, counterintuitive to a lot of us that at the time that this disease is taking off, there would be a furlough going on. And I know you mentioned part of that was these elective surgeries. Maybe emergency department visits are down because things like car accidents or something like that are down. So is this a matter of we want to really make sure that we are prepared for an influx, or is this a strong prediction, if that makes sense? Is it preparation, or we have a very, very strong prediction that things are going to take off very soon?
Well, we're watching the models closely, and there are more than one model out there in terms of when the surge is going to happen for San Juan County, sometime within the next 2 to 3 weeks. But the reality is, for not only our hospital, but hospitals everywhere, for the most part, our volumes are just really off from what they used to be due to the limitation on only providing essential healthcare services. And we agree. We agree with that action by our state. We think it's the right thing to help control the spread. It's a well-known public health strategy that the social distancing and limitations on non-essential services really help control the spread, but it has consequences for all businesses, not just ours. But it is counterintuitive. But our ER volumes are off, our surgical volumes are off, our clinic volumes are off, our imaging volumes are off, all significantly. So, what we've done is very similar to what we're seeing hospitals do elsewhere across the state and the country.
Got it. And Mr. Bourgeois, you mentioned that those are probably the areas then where you've seen some of these furloughs or had to make some of these furloughs, but you've mentioned that you've been able to use the term furlough and not necessarily layoff, which keeps some of these folks getting some benefits and things along that line?
That's correct, Scott. Thank you for mentioning that. We did structure this as a temporary furlough, not a layoff, and we will plan to recall staff as our patient care volumes return on the backside of the surge and the peak and whatever life looks like for all of us after we get through the short-term window with the spike in cases in New Mexico.
Now, does this also include non-medical staff? I mean, obviously hospitals have tons of non-medical staff, housekeeping, record keeping, things like that. Are they included in this as well?
Certainly, Megan, yes. And so a lot of non-direct patient care areas, non-clinical areas, if you will. We went through our entire organization, department by department, and looked at where we needed staff and where we didn't in this short-term circumstance.
Great.
Got it. And Mr. Bourgeois, can you give us maybe some idea on the census at the hospital then? I know, have you been trying to maybe move some or create some new bed areas for coronavirus patients, perhaps, if and when the surge happens, or when the surge happens, maybe not if, but
right.
when, and we're also aware of maybe kind of a field hospital, if you will, at the National Guard Armory that's been created for another maybe 50-bed capacity. Is that an accurate number, or is that something that the hospital's working with as well?
Yes, so let me several questions there, Scott.
There were. Yes, I'm sorry.
Start with the field hospital.
Yeah, so our census, for example, yesterday in our emergency department, we saw 88 patients. That's roughly half of what we would typically see on a day like that. We currently have 107 patients in the hospital today, which is much lower than the field hospital that you referenced, actually, we had deployed to us assets from it's called an alternate treatment facility, is what the National Guard likes to call it. And they're assets that we are able to deploy within the walls of our hospital. So we will not be setting up something separate outside of the hospital walls. We felt it was best to prepare for the surge within the confines of the hospital, because that's where all of our infrastructure and support services could best help meet the needs of the patient. So we've consolidated a couple of inpatient units on the third and second floor down to the second floor, and then we will use the third floor for really our surge capacity. Currently, all COVID patients in the hospital are on the fourth floor, where our medical unit is and our ICU is, and we are well within the capacity that we are well within the capacity of the fourth floor now, given the COVID patients that we have in house today.
I see. But you've kind of planned for room to grow your capacity when the time comes, if the time comes.
That is exactly right, Scott. Thank you.
Gotcha. Very good. And then, Mr. Bourgeois, we've been talking a little bit with some of your doctors, of course, and those folks who are kind of on the front lines of this. And again, I know there are stories every day of how your staff is going above and beyond and dealing with this. We've talked a little bit about personal protection gear and the need for that. Can you give us a sense? Are your supplies still good? I know we talked to Ginger Palmer last week and Teresa Becker about volunteerism and donations of cash and goods. So again, another multiple question for you. I apologize, but can you talk a little bit about, I guess, equipment and personal protection gear at the hospital if you have enough, and then again about how folks can maybe make a donation if they would like to do that?
Okay, certainly, Scott. Thank you. So for right now, our personal protective equipment is in good shape. We have an adequate supply. We are continuing to build up extra inventory wherever possible. So we are working with several different sources out in the community for some people at PESCO, as well as the Makers Lab up at Fort Lewis College with their 3D printers, making face shields that we can use to help protect caregivers on the front line. We have several sources making gowns, isolation gowns for us that we're able to use. We've had a number of donations of homemade face masks, as well as a number of folks early on when this first started becoming news here that had an industrial business of some sort where they also used the N95 respirator mask that you hear so much about on the news. And we received a lot of donations from community organizations of those as well. There are two. As far as contributions and donations to the hospital, any monetary donations I would direct to San Juan Medical Foundation. They have an account set up to intake financial contributions, and those of course are tax deductible. And then we've had any number of local restaurants offer to make meals for our staff, and we really need to coordinate that. So we've identified Teresa Becker, as you mentioned, to help coordinate that for us. So she's the point of contact at our hospital if someone out there wants to donate food. There's certain steps we need to take to make sure that we can receive the food safely and distribute it safely to the staff.
Certainly. Well, but again, shows just how caring of a community we have when folks want to do that, whether it's money or food or other items for these frontline workers. Jeff Bourgeois. We just have a couple of minutes remaining. Is there any other point you want to make? Is there anything else that maybe you're hearing that is a little misconception that folks have in the community that you want to try to correct at this time?
Well, I'd first of all just like to say thank you to the community at large for all the support they've been giving us. I'd like to say thank you to the state. They took some actions to advance some payments to hospitals to help us during our cash shortfall that due to the lack of work or reduction in work that we've seen. And then, of course, just thank you to all the frontline caregivers throughout our organization who are doing such tremendous work. I just want to make sure that the community knows that we are well prepared. We have the means to care for the patient loads that we are currently experiencing. We are not overrun. We are closely watching the models that our state is putting out, and again, within the next 2 to 3 weeks, the state as well as San Juan County is expected to have its peak surge. We believe right now we'll be within our capacity to meet the patient care demands that are presented to us. So, oftentimes you hear things that when we are taking donations for PPE, et cetera, it's because we're overrun. That's not the fact. The fact is we're taking donations and being careful to build up our inventory so we are well prepared when we do have a surge.
Understood. And Mr. Bourgeois, when this surge comes, as has been predicted by the state, I know there are resources that are available if, in fact, it is larger than you anticipate that you can call on to beef up either your staff or your supplies. Is that what the state is making available to you?
Well, what the state has made available through that alternative treatment facility are some extra beds and stretchers and some equipment. And then the Medical Service Corps is a staffing resource that we will reach out to, as well as a labor pool we've set up within the hospital to reassign people to jobs that they might not typically work should we really have a peak in our inpatient census.
Understood. Well, Jeff Bourgeois, again, we can't thank you enough for joining us on the program to get us the correct information and the most up-to-date information, and we appreciate that. Thank you very much.
Scott, appreciate all you do to get the word out for our community. Thank you very much.
You're very welcome. That is Jeff Bourgeois, everyone. He's the CEO of San Juan Regional Medical Center. He joined us live this morning on our coronavirus local information program. I'm here along with Megan Cullip, and we are broadcasting the program on KSJE. It's also rebroadcast on the radio later on today, and also on KNMI, our other public radio partner in Farmington.
That's right.
Good information?
Good information.
Right?
That's super helpful. Yeah.
I think it is for folks to know and to understand. But again, we never like to see furloughs or layoffs or job losses, but it kind of helps to maybe have them explain why they did what they did.
Well, yeah, they did what they did, which, and also just they're still in a better position than, now the 16 million Americans who are actually laid off, right? So I think they handled that pretty well, given the constraints,
Well, right. When you don't have those patient numbers, you just can't keep the staffing at the numbers that you normally would. But again, as Mr. Bourgeois mentioned, when we're on the other side of this, you can start calling people back.
You call them back, yeah. And I mean, of course, it's never a bad thing that hospital censuses go down, right?
Well, no, that means that we're healthier,
I
guess, right? And not getting into as many accidents, and the emergency department numbers are down, and so that's a good thing.
I'm really interested in the origin of that. Like, I do feel like part of it is probably a downtick in accidents given the quarantine situation, but I also wonder if it's a lot of those, the folks that might go into the emergency department with illnesses where they end up getting sent home with the Tylenol and Gatorade or whatever, if some of that has gone down, because in general people are a little leery of going to the emergency room now.
Being around other sick people, who may actually be sick. Yeah. That may be.
Could be.
I don't know.
I don't know if there's...
Can you do some research on that? Let us know.
I can.
Stay tuned tomorrow, everyone. It's a serial now that we have.
We could call it Answers to Questions You Never Really Asked.
Right?
Yeah. Answers to questions that you don't find as interesting as Megan.
Answers to questions you didn't know you had. See?
I'm good for that.
There we are. All right. We'll try it. We'll see what happens. Very good. What else today? We've covered, I think, a lot of what's been going on.
We've covered a lot of what's been going on.
Right?
Yeah. I am bemoaning the death of good musicians these days.
Well, right. That's been terrible. There was, we talked about John Prine last time, and then there was a jazz musician.
Yeah, Marcellus Jr., yep. And Bill Withers as well.
Yes.
Marcellus Jr. and John Prine died of COVID, but Bill Withers just... other causes. But yeah, so
we don't like that.
We don't like that. We do not like that. But on the bright side of music, news, there's still all these people doing weekend quarantine house concerts, which is kind of cool.
That is kind of cool.
Yeah, I'm always a little uncomfortable about being let into people's like kitchens and living rooms and stuff. I don't know if anybody else is having that sort of dynamic when it comes to work meetings, where you're all of a sudden seeing somebody's parlor. For those of us I don't have a parlor.
Parlor?
Yeah, I don't know. I bet Jeff Bourgeois has a parlor.
Are you sure you're not 100 years old?
Yeah.
Oh my goodness.
Well, I
don't think we've had parlors in this country for 100 years, but okay.
I don't know.
All righty.
That's the first thing that came to me. Yeah.
Okay.
Yep.
Well, there's that, everyone. I don't know what to say to that.
Perhaps the Russian hound pictures on one's hearth.
Yeah. You don't like that?
I love it.
Okay.
Which one of us has, if the listeners could guess, which one of us has paintings of Russian hounds? Me
You?
or
Me.
Scott?
I don't know. Okay. Maybe I'll do the show from home one day.
Yeah.
Then
People can call in.
they could call in. That's true. Well, speaking of calling in, if you want to call in, we're probably wrapping up our show today. We'd still love to hear from our listeners. We know you're out there, Facebook land. We know you're watching, 566-3909, if you would like to call and just say hello, maybe make fun of me or Megan.
Right.
I think we're equal opportunity
we are
co-hosts.
equal. Yeah, we're easy targets.
We are.
All around. I'm surprised that you went with you first, actually.
Well, I just,
trying to be nice.
because people couldn't hear you for the first half of the show, so I feel bad about that.
I guess is that true?
You weren't as loud as I was. I was louder.
Usually,
I believe the
I
term
am
was
very
significantly
loud.
louder.
Significantly
than you.
louder.
I'm sorry for that.
Sorry, guys. Yeah,
Yes.
normally that's not the case with me. Call in, tell some jokes. I'm still waiting on people's hobbies.
Right.
They're like this. There's a big
Apparently
bread.
yours is weeding.
Gosh, well, yeah, that feels like an exercise in futility, but it's like,
a good hobby, but-
it's getting bad out there. Yeah, I mean, it is what it is, right? But I was
Bread.
bemoaning with Scott, like, who decides what makes a weed and what makes a flower, right? Because I don't have any vegetables where weeds are choking them out. I'm just kind of like, why is this less valuable in our eyes than these other forms of vegetation?
Sure. Let them grow, and then guess what? The city code compliance will come by and tell you which are weeds and which are flowers.
That's right. They'll make that abundantly clear. Now, I make
will.
sure that the ones you can see from the road are
Good.
picked immediately.
Okay.
But yeah, bread making.
People are doing that?
Yeah.
Rediscovering cooking?
Lots of
baking?
stuff about starters. Apparently, there's like sourdough starters. It's a thing.
Right.
And obviously, it's a living thing, and it grows from there. I mean, I'm not exactly looking to add like a hobby that I would not enjoy during this quarantine.
Well, I hear you.
Yeah, but I get to be the recipient of all sorts of good things.
Very nice.
Brought upon by other people's baking habits.
And you are sharing your wealth, too, which we appreciate.
Yeah.
Here at the station.
That's right.
Thank you very much.
Since we're already in close contact to each other, I feel like I can.
That's true.
Yeah.
We'll spray you down. I guess we're done.
Sprayed me down.
I think we're done.
I think so.
On that note,
we should probably wrap this up.
I think we probably should. But, our positive thought for the day before
We've given a lot of them.
we have given a lot of them.
I
Is there
feel like-
anything else to give, I guess, is my point.
I mean, that's what I've got.
Okay.
Yeah.
I like the parades. I like the messages on the chalk messages.
Yeah,
on
the
sidewalks.
murals. There's a great deal of murals in downtown Farmington too that I encourage people to check out.
Okay.
Yeah.
Safely. So check them out safely.
Right.
Everybody.
Away from each other.
That's right.
One at a time.
That's it. That's true. All right, everyone. Well, thank you for joining us, everybody. Again, we are doing this Monday through Thursday at 9 a.m. It's live on the KSJE Facebook page and YouTube channel. We are finding guests to share what's going on in the community. Local information. Again, the statewide media does a great job of talking about whatever statewide issues are going on, but we feel there's a need for local information, and that's why we're here.
That's why we're here.
We'll see you tomorrow.
See you tomorrow.
Okay. I'm Scott Micklin along with Megan Cullop. Have a great Monday, everyone.